America. Our Money Daily starts right now. Uganda and Kenya are the latest East African countries to secure funding for COVID-19 response efforts from multilateral lenders amidst growing calls from citizens for accountability in the usage of the money. For the most part, concerns about ballooning public debt have been raised and amounts spent or lost have come under scrutiny. The African Development Bank has disbursed $3.7 billion across the continent under the COVID-19 response facility. An estimated $20 million went to Sahel countries including Burkina Faso, Chad, Mali, Mauritania and Niger to strengthen their national capabilities to stop the spread of COVID-19 and mitigate the socio-economic impact of the pandemic. Now, African governments are allocating budgets for vaccine rollouts. The World Bank says it is dishing out $4 billion for the purchase and deployment of COVID-19 vaccines for 51 countries, half of which are in Africa. Eswatini, Malawi, Lesotho, Togo and Zambia are some of the countries which will benefit from the initiative. So in East Africa, Kenya accounts for the lion's share of financial support from multilateral lenders. So we turn to our Biz 100 experts from across the country. We asked them whether they think COVID funds are being utilized properly, and this is what they had to say.
Some other areas of financial assistance that I see is specifically in the area of supply chain strengthening. Like, for example, enhancing local manufacturing of COVID-19 commodities and technology transfer for vaccines and pharmaceuticals to be manufactured in low and middle income countries.
Just recently, we saw what happened with the cancer scandal in Kenya, where billions were lost through scrupulous deals. But to date, we haven't seen no one being held accountable. And so the person who ends up suffering is the citizen, because we are taxed more to pay back some of these loans. So I think it's important that even as citizens, we demand accountability.
Joining me now from Tel Aviv is Yotam Poliza, the CEO of IsraAid, a non-governmental organization which has been working with the government of Eswatini in rolling out COVID-19 vaccination. Thank you so much for joining us. So when we talk about accountability, which is a point that has come out very clearly, how do we hold power to account when it comes to COVID-19 funds?
I think the key is all about collaborations. Collaborations between the government, the private sectors, NGOs, faith-based organizations. I mean, in Eswatini, for example, we really created and coordinated a very large network of partners from all the different groups that I mentioned above. And I think that's the key to success. And the government should be able to utilize all these partners and their skills. Many of them, have been in the country for many years working on HIV/AIDS prevention and response. So the key to succeeding in utilizing these funds is all about partnerships.
What needs to be done, do you think, to make sure that these funds are trickling down to the grassroots level?
So at Eswatini, for example, IsraAid established a control center using a lot of technology with very innovative approaches. And I think that proved to be a very successful model for us, because we're receiving all the data from the partners on the ground, so we could really make sure that the funds, the vaccines, and all the relief supplies that are related to COVID really reach the most vulnerable population, which we know is not the case in many other places.
So we've seen quite a lot of money being dispersed over the last couple of weeks as countries are looking to roll out vaccines. How should these funds be allocated, do you think, in terms of the key areas of priority that African governments should focus on?
So I think apart from obviously procuring the actual vaccines, there's not enough funding for all the other important elements of the rollout. I mean, Israel, as you probably know, has been the first vaccinated country in the world, and that's thanks to a very organized and well-established public health support system. So it goes from the cold chain to the logistics, to the data management, to utilizing all the both the public sector and the private sector. So I think the role of the government and this multinational organization will be to create this network and coordination mechanism, and that's really the key to success. and distributing all the funds between all the relevant partners and actors.
Thank you so much for your time.